Hello, my name is Peter Brune and I'm the Secretary General of War Child Sweden. Beside the role to head the Stockholm office of War Child, I'm also the chairperson of the Swedish network on MHPSS in global situations and more specifically in humanitarian fragile settings. In this video, I'm going to elaborate on a new report that we at War Child Sweden produced during the first semester of 2023 in connection to the Swedish Presidency of the European Union. The report is called Mental Health, a Human Right Left Behind, the Situation in Sweden, Europe and Globally. I use the acronym MHPSS. That means Mental Health and Psychosocial Support. The thematic aspect that we are focusing on is precisely all the different aspects of a complex area related to our mental health, our mental well-being, what type of psychosocial support we can provide, thus the acronym MHPSS. In this report, developed in March 2023, we will look into what the role of different actors in promoting a more holistic response to the global mental health crisis can be. On this topic, we need to relate it to the figures, which are quite clear. More and more people are in need of handling their mental health, need support. And we also need to improve our understanding of what all this means to react to this global mental health crisis. So we asked more than 500 recipients in Sweden through a questionnaire on how they perceive the role of the different actors, especially in connection to the EU and the role of the EU, and the role of the growing role of the EU when it comes to mental health and health coverage for all. So these questionnaires, more than 500 recipients, were sent to 4 types of recipients: civil society, public sector representatives, academia and the private sector. Roughly a third of the respondents came from the public sector, another third from the civil society sector, and the rest were academia, private sector and others. What we especially focused on was the role of the different actors in terms of how to prevent mental health issues and how we can focus on the situation of young people in our societies. It is very clear that the young people in the world are the most affected, and that the earlier we act, the better. Early action and stigma reduction are 2 very important components in order to prevent an escalating mental health crisis. It's also clear that we all need to deepen our understanding, learn more, develop different tools and skills as we all promote networking so that we can collectively react to the challenges that we see. One interesting example of how we can actually work together more holistically is something called the Copenhagen Roadmap, which we'll link to in our report on the role of the European Union. The roadmap is based on an initiative by the Swedish Network on Mental Health in Global and Humanitarian Settings, and the one that I'm heading. And we reach out to our colleagues in the other Nordic countries, many of them member of the European Union, and to see how we can work together as a region on this topic. All of this all the time having the global perspective in mind. We came together for a first successful meeting in Copenhagen in August 2022, where we gathered 120 stakeholders working on mental health and psychosocial support. The meeting was very successful and resulted in the declaration, but more concretely in a joint roadmap. The Copenhagen on how to systematically integrate our work on mental health and psychosocial support into our work with the UN Sustainable Development Goals and the Agenda 2030, but also how the EU can play an important role in this regard. This can give us a good idea on how to bridge the gap between the different actors, for example, between practitioners and researchers, but also for a more long-term oriented approach on the mental health crisis. Based on the findings and the recipients responding to our questionnaire, we have come up with 5 recommendations for the EU. The first one is that we need to learn more and do training to develop our skills. We need to enhance our understanding of what MHPSS is all about. The second recommendation is working long term. This problem is not a quick fix. We need to work in a period of over decades. Thirdly, one important opportunity is to link the mental health agenda with the SDGs in a systematic way. Not only the ones related to health in the SDGs, maybe more specifically 3, but also the SDGs related to gender, on education, and on peaceful societies. The mental health agenda and the psychosocial support that we need to provide is connected to almost all of the 17 SDGs. Fourthly, we need to work on making resources available where the EU can play a very important role. Not only financial resources, but also additional resources that we need to dedicate to the growing mental health crisis. Finally, the fifth recommendation is to look at the experience of the Swedish network that is organized under the Swedish Institute for Global Health Transformation. You can visit the website www.site.nu, where you can find more information about the report and the different resources available in the field. The link will also be repeated at the end of this report, of this video. We have come quite far in comparison with other countries on how to coordinate on a national level with mental health and psychosocial support. Hopefully, this can serve as an example of how global mental health can be improved also globally. In summary, Watch Out Sweden produced a report on the role of the EU and the different actors on mental health and psychosocial support. This report is available on the following website, and we hope you do join us in our continued work to promote mental health and psychosocial support in the global perspective. Thank you so much for your attention, and let's be in touch with regards to the future work.